Hi everybody and welcome to my channel Hobet Bibi. Earlier I posted an overview about stroke. I hope you have already seen that short video. And today I am going to discuss this serious medical emergency in detail. Well, a stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. A stroke is a medical emergency and prompt treatment is crucial. Early action can reduce brain damage and other complications. The good news is that nowadays fewer people die of stroke than in the past because effective treatments are available, and these treatments can also help prevent disability from stroke. Now let me tell you the symptoms. If you or someone you are with may be having a stroke, pay particular attention to the time the symptoms begin. Some treatment options are most effective when given soon after a stroke begins. Signs and symptoms of stroke include trouble speaking and understanding what others are saying. You may experience confusion, slur your words, or have difficulty understanding speech. Paralysis or numbness of the face, arm, or leg. You may develop sudden numbness, weakness, or paralysis in your face, arm, or leg. This often affects just one side of your body. Try to raise both your arms over your head at the same time. If one arm begins to fall, you may be having a stroke. Also, one side of your mouth may droop when you try to smile. Problem seeing in one or both eyes. You may suddenly have blurred or blackened vision in one or both eyes, or you may see double. Headache. A sudden severe headache which may be accompanied by vomiting, dizziness, or altered consciousness may indicate that you are having a stroke. Trouble walking. You may stumble or lose your balance. You may also have sudden dizziness or a loss of coordination. You should seek immediate medical attention if you notice any sign or symptom of a stroke, even if they seem to come and go or they disappear completely. For stroke, we use an abbreviation FAST, that is fast. This stands for, FAST stands for, F stands for face, A stands for arms, S stands for speech, and T stands for time. Okay, first let me tell you about the face. If somebody is experiencing stroke or you have any doubts, then you should ask the person to smile. Does one side of the face droop? This is a sign of a stroke. Also, regarding arms, A of arms, you ask the question to the patient to raise both arms and notice if one arm drifts downward or is one arm unable to rise. Okay, the S of fast stands for speech. And if you have any suspicion about a stroke, then ask that person who is suffering from stroke to repeat a simple phrase, and notice is his or her speech slurred or strange. Then the T of the fast stands for time. If you observe any of these signs, then you should call your local emergency medical help immediately. You should call your local emergency number right away. Do not wait to see if symptoms stop. Every minute counts. The longer a stroke goes untreated, the greater the potential for brain damage and disability. If you are with someone you suspect is having a stroke, watch the person carefully while waiting for emergency assistance. Now let me tell you the causes. There are two main causes of a stroke. A blocked artery that causes ischemic stroke, or leaking or bursting of a blood vessel that is called hemorrhagic stroke. Some people may have only a temporary disruption of blood flow to the brain, that is known as transient ischemic attack, or TIA in short form. This TIA does not cause lasting symptoms. Now first let me tell you about the ischemic stroke. This is the most common type of stroke. It happens when the brain's blood vessels become narrowed or blocked, causing severely reduced blood flow, that is ischemia. Blocked or narrowed blood vessels are caused by fatty deposits that build up in blood vessels or by blood clots or other debris that travel through your bloodstream and lodge in the blood vessels in your brain. Some initial research shows that COVID-19 infection may be a possible cause of ischemic stroke, but more study is needed. And as you know, nowadays there is a pandemic of COVID-19. Okay. Now let me tell you about hemorrhagic stroke. Hemorrhagic strokes occur when a blood vessel in your brain leaks or ruptures. Brain hemorrhages can result from many conditions that affect your blood vessels. Factors related to hemorrhagic stroke include uncontrolled high blood pressure, over-treatment with blood thinners, over-treatment with anticoagulants, bulges at weak spots in your blood vessel walls, which are known as aneurysm. Then another factor is trauma, such as a car accident, protein deposits in blood vessel wall that lead to weakness in the vessel wall. This condition is known as cerebral amyloid angiopathy, although this condition is rare. Okay. Also, ischemic stroke can lead to hemorrhage. A less common cause of bleeding in the brain is the rupture of an abnormal tangle of thin-walled blood vessels, which are known as arteriovenous malformations. Now let me tell you something about transient ischemic attack, that is TIA. A TIA, sometimes known as a mini stroke, is a temporary period of symptoms similar to those you would have in a stroke. A TIA does not cause permanent damage. They are caused by a temporary decrease in blood supply to part of your brain, which may last as little as 5 minutes. Like an ischemic stroke, a TIA occurs when a blood clot or debris reduces or blocks blood flow to part of your nervous system. You should seek emergency care even if you think you have had a TIA because your symptoms got better. It's not possible to tell if you are having a stroke or TIA based only on your symptoms. If you have had a TIA, it means you may have a partially blocked or narrowed artery leading to your brain. Having a TIA increases your risk of having a full-blown stroke later. Now let me tell you the risk factors. Many factors can increase your stroke risk. Potentially treatable stroke risk factors include lifestyle risk factors. These are being overweight or obese, physical inactivity, heavy or binge drinking, use of illegal drugs such as cocaine and methamphetamine. Now I'll tell you about medical risk factors. The medical risk factors include high blood pressure, cigarette smoking or second-hand smoke exposure, which is also known as passive smoking, high cholesterol, diabetes, obstructive sleep apnea, cardiovascular disease including heart failure, heart defects, heart infection or abnormal heart rhythm such as atrial fibrillation, which is a common cause. Personal or family history of stroke, heart attack or transient ischemic attack. And also, as I told you before, COVID-19 infection is also a risk factor for stroke. Other factors associated with a high risk of stroke include age. People aged 55 or older have a higher risk of stroke than do younger people. Race. African Americans have a higher risk of stroke than do people of other races. Sex. Men have a higher risk of stroke than women. Women are usually older when they have strokes and they are more likely to die of strokes than are men. Hormones. Use of birth control pills or hormone therapy that include estrogen increases risk. Now let me tell you the complications. A stroke can sometimes cause temporary or permanent disabilities depending on how long the brain lacks blood flow and which part was affected. Complications may include paralysis or loss of muscle movement. You may become paralyzed on one side of your body or lose control of certain muscles such as those on one side of your face or one arm. Difficulty talking or swallowing. A stroke might affect control of the muscles in your mouth and throat, making it difficult for you to talk clearly, swallow, or eat. You also may have difficulty with language, including speaking or understanding speech, reading, or writing. Memory loss or thinking difficulties. Many people who have had strokes experience some memory loss. Others may have difficulty thinking, reasoning, making judgments, and understanding concepts. Emotional problems. People who have had strokes may have more difficulty controlling their emotions or they may develop depression. Pain. Pain, numbness, or other unusual sensations may occur in the parts of the body affected by stroke. For example, if a stroke causes you to lose feeling in your left arm, you may develop an uncomfortable tingling sensation in that arm. Changes in behavior and self-care ability. People who have had strokes may become more withdrawn. They may need help with grooming and daily chores. Now let me tell you about prevention. Knowing your stroke risk factor, following your doctor recommendation, and adopting a healthy lifestyle are the best steps you can take to prevent a stroke. If you have had a stroke or a transient ischemic attack, the measures which I am going to tell you might help prevent another stroke. The follow-up care you receive in the hospital and afterward also may play a role. Many stroke prevention strategies are the same as strategies to prevent heart disease. In general, healthy lifestyle recommendations include controlling high blood pressure, that is hypertension. This is one of the most important things you can do to reduce your stroke risk. If you have had a stroke, lowering your blood pressure can help prevent a subsequent TIA or stroke. Healthy lifestyle changes and medications are often used to treat high blood pressure. Lowering the amount of cholesterol and saturated fats in your diet. Eating less cholesterol and fat, especially saturated fat and trans fats, may reduce the build-up in your arteries. If you cannot control your cholesterol through dietary changes alone, your doctor may prescribe a cholesterol-lowering medication. Quitting tobacco use. Smoking raises the risk of stroke for smokers and non-smokers exposed to second-hand smoke. Quitting tobacco use reduces your risk of stroke. Managing diabetes. Diet, exercise, and losing weight can also help you keep your blood sugar in a healthy range. If lifestyle factors do not seem to be enough to control your diabetes, your doctor may prescribe medication. I have a very good video about diabetes on my channel that is also very helpful. You can see that video. Maintaining a healthy weight. Being overweight contributes to other stroke factors such as high blood pressure, cardiovascular disease, and diabetes. Eating a diet rich in fruits and vegetables. A diet containing 5 or more servings of fruits or vegetables may reduce your risk of stroke. The Mediterranean diet, which emphasizes olive oil, fruits, nuts, vegetables, and whole grains, may be helpful. Exercising regularly. Aerobic exercises reduces your risk of stroke in many ways. Exercise can lower your blood pressure, increase your level of good cholesterol, and improve the overall health of your blood vessels and heart. It also helps you lose weight, control diabetes, and reduce stress. Gradually work up to at least 30 minutes of moderate physical activity such as walking, jogging, swimming, or bicycling on most, if not all, days of the week. Drinking alcohol in moderation, if at all. Heavy alcohol consumption increases your risk of high blood pressure, ischemic stroke, and hemorrhagic stroke. Alcohol may also interact with other drugs you are taking. However, drinking small to moderate amounts of alcohol, such as 1 drink a day, may help prevent ischemic stroke and decrease your blood clotting tendency. You should talk to your doctor about what's appropriate for you. Treating obstructive sleep apnea. Your doctor may recommend a sleep study if you have symptoms of obstructive sleep apnea, which is a sleep disorder that causes you to stop breathing for short periods repeatedly during sleep. Treatment for obstructive sleep apnea includes a device that delivers positive airway pressure through a mask to keep your airway open while you sleep. Avoiding illegal drugs. Certain street drugs such as cocaine and methamphetamine are established risk factors for a TIA or a stroke. Now I will tell you about the preventive medications. If you have had an ischemic stroke or TIA, your doctor may recommend medication to help reduce your risk of having another stroke. These medications include antiplatelet drugs. Platelets are cells in your blood that form clots. Antiplatelet drugs make these cells less sticky and less likely to clot. The most commonly used antiplatelet medication is aspirin. Your doctor can help you determine the right dose of aspirin for you. Your doctor might also consider prescribing Agrinox, which is a combination of low-dose aspirin and the antiplatelet drug dispridamole to reduce the risk of blood clotting. After a TIA or mini stroke, your doctor may give you aspirin and an antiplatelet drug such as clopidogrel that comes with the name of Plavix. This drug can be given for a period of time to reduce the risk of another stroke. If you cannot take aspirin, your doctor may prescribe clopidogrel alone. Anticoagulants. These drugs reduce blood clotting. Heparin is fast acting and may be used for short term in the hospital. Slower acting warfarin that comes with the name of Coumadin, Gentovin, may be used for over a long term. Warfarin is a powerful blood thinning drug, so you will need to take it exactly as directed and watch for side effects. You will also need to have regular blood tests to monitor warfarin's effect. Several newer blood thinning medications, which are known as anticoagulants, are available for preventing strokes in people who have a high risk. These medications include dabigatran, that comes with the name of Pradaxa, Rivorexaban, that comes with the name of Xarelto, Apixaban, that comes with the name of Eliquis, and Edoxaban, that comes with the name of Savesa. They are shorter acting than warfarin and usually do not require regular blood test or monitoring by your doctor. These drugs are also associated with a lower risk of bleeding and complications. Now I will tell you about the diagnosis of stroke. Things will move quickly once you get to the hospital, as your emergency team tries to determine which type of stroke you are having. That means you will have a CT scan or other imaging test soon after your arrival. Doctors also need to rule out other possible causes of your symptoms, such as a brain tumor or a drug reaction. A physical exam. Your doctor will do a number of tests you are familiar with, such as listening to your heart and checking your blood pressure. You will also have a neurological exam to see how a potential stroke is affecting your nervous system. Blood test. You may have several blood tests, including tests to check how fast your blood clots, whether your blood sugar is too high or low, and whether you have an infection. Computerized tomography, that is CT scan. A CT scan uses a series of X-rays to create a detailed image of your brain. A CT scan can show bleeding in the brain, an ischemic stroke, a tumor, or other conditions. Doctors may inject a dye into your bloodstream to view your blood vessels in your neck and brain in greater detail. That is called computerized tomography angiography. And magnetic resonance imaging, that is MRI. This uses powerful radio waves and magnets to create a detailed view of your brain. An MRI can detect brain tissue damaged by an ischemic stroke and brain hemorrhages. Your doctor may inject a dye into a blood vessel to view the arteries and veins and highlight blood flow. That is known as magnetic resonance angiography or magnetic resonance venography. Carotid ultrasound. In this test, sound waves create detailed images of the inside of the carotid arteries in your neck. This test shows a build-up of fatty deposits that are plaques and blood flows and blood flow in your carotid arteries. Cerebral angiogram. In this uncommonly used test, your doctor inserts a thin, flexible tube, that is catheter, through a small incision, usually in your groin, and guides it through your major arteries and into your carotid or vertebral artery. Then your doctor injects a dye into your blood vessels to make them visible under X-ray imaging. This procedure gives a detailed view of arteries in your brain and neck. Echocardiogram. An echocardiogram uses sound waves to create detailed images of your heart. An echocardiogram can find a source of clots in your heart that may have traveled from your heart to your brain and caused your stroke. Now let me tell you the treatment. Emergency treatment for stroke depends on whether you are having an ischemic stroke or a stroke that involves bleeding into the brain, and that is hemorrhagic stroke. First, let me tell you the treatment of ischemic stroke. To treat an ischemic stroke, doctors must quickly restore blood flow to your brain. This may be done with emergency IV medication. Therapy with drugs that can break up a clot has to be given within 4.5 hours from when symptoms first started, if given intravenously. The sooner these drugs are given, the better. Quick treatment not only improves your chance of survival, but also may reduce complications. An IV injection of recombinant tissue plasminogen activator, that is known as TPA in short form, also called altiplase, is the gold standard treatment for ischemic stroke. An injection of TPA is usually given through a vein in the arm within the first 3 hours. Sometimes TPA can be given up to 4.5 hours after stroke symptoms started. This drug restores blood flow by dissolving the blood clot causing your stroke. By quickly removing the cause of the stroke, it may help people recover more fully from a stroke. Your doctor will consider certain risks, such as potential bleeding in the brain, to determine if TPA is appropriate for you. Emergency endovascular procedures. Doctors sometimes treat ischemic stroke directly inside the blocked blood vessel. Endovascular therapy has been shown to significantly improve outcomes and reduce long-term disability after ischemic stroke. These procedures must be performed as soon as possible. The medication delivered directly to the brain. Doctors insert a long thin tube, that is catheter, through an artery in your brain and thread it to your brain to deliver TPA directly where the stroke is happening. The time window for this treatment is somewhat longer than for injected TPA, but is still limited. Removing the clot with a stent retriever. Doctor can use a device attached to a catheter to directly remove the clot from the blocked blood vessel in your brain. This procedure is particularly beneficial for people with large clots that cannot be completely dissolved with TPA. This procedure is often performed in combination with injected TPA. The time window when these procedures can be considered has been expanding due to newer imaging technology. Doctors may order perfusion imaging tests done with the CT or MRI to help determine how likely it is that someone can benefit from endovascular therapy. There are some other procedures to decrease your risk of having another stroke or transient ischemic attack. We sometimes recommend a procedure to open up an artery that is narrowed by plaque. Options vary depending upon your situation, and these options include carotid endarterectomy. Carotid arteries are the blood vessels that run along each side of your neck, supplying your brain with blood. This surgery removes the plaque blocking a carotid artery and may reduce your risk of ischemic stroke. A carotid endarterectomy also involves risk, especially for people with heart disease or other medical conditions. Angioplasty and stents. In an angioplasty, a surgeon threads a catheter to your carotid arteries through an artery in your groin. A balloon is then inflated to expand the narrowed artery. Then a stent can be inserted to support the open artery. So this was the treatment for ischemic stroke. Now I will tell you the treatment for hemorrhagic stroke. Emergency treatment hemorrhagic stroke focuses on controlling the bleeding and reducing pressure in your brain caused by excessive fluid. Treatment options include emergency measures. If you take blood thinning medication to prevent blood clots, you may be given drugs or transfusions of blood products to counteract the blood thinner's effects. You may also be given drugs to lower the pressure in your brain, that is intracranial pressure. You can be given drugs to lower your blood pressure, prevent spasm of your blood vessel, and prevent seizures. Surgery. If the area of bleeding is large, your doctor may perform surgery to remove the blood and relieve pressure on your brain. Surgery may also be used to repair blood vessel problems associated with hemorrhagic strokes. Your doctor may recommend the procedure which I am going to tell you after a stroke or if an aneurysm, arteriovenous malformation, or other type of blood vessel problem cause your hemorrhagic stroke. These include surgical clipping. A surgeon places a tiny clamp at the base of the aneurysm to stop blood flow to it. This clamp can keep the aneurysm from bursting, or it can keep an aneurysm that has recently hemorrhaged from bleeding again. Coiling, that is known as endovascular embolization. Using a catheter inserted into an artery in your groin and guided to your brain, your surgeon will place tiny detachable coils into the aneurysm to fill it. This blocks blood flow into the aneurysm and causes blood to clot. Surgical arteriovenous malformation removal. Surgeons may remove a smaller AVM if it is located in an accessible area of your brain. This eliminates the risk of rupture and lowers the risk of hemorrhagic stroke. However, it is not always possible to remove an AVM if it is located deep within the brain, or if it is large, or its removal would cause too much of an impact on brain function. And then there is another option that is known as stereotactic radiosurgery. Using multiple beams of highly focused radiations, stereotactic radiosurgery is an advanced, minimally invasive treatment used to repair blood vessel malformations. So these were the treatment options for hemorrhagic strokes. Lastly, I should tell you something about stroke recovery and rehabilitation, which is also important to note. After emergency treatment, you will be closely monitored for at least a day. After that, stroke care focuses on helping you recover as much function as possible and return to independent living. The impact of your stroke depends on the area of the brain involved and the amount of tissue damage. If your stroke affected the right side of your brain, your movement and sensation on the left side of your body may be affected. If your stroke damaged the brain tissue on the left side of your brain, your movement and sensation on the right side of your body may be affected. Brain damage to the left side of your brain may cause speech and language disorders. Most stroke survivors go to a rehabilitation program. Your doctor will recommend the most rigorous therapy program you can handle based on your age, overall health, and degree of disability from your stroke. Your doctor will also take into consideration your lifestyle, interest, and priority, and the availability of family members or other caregivers. Rehabilitation may begin before you leave the hospital. After discharge, you might continue your program in a rehabilitation unit of the same hospital or another rehabilitation unit or skilled nursing facility as an outpatient or at home. Every person's stroke recovery is different depending on your condition. Your treatment team may include doctor trained in brain condition, that is a neurologist, a rehabilitation doctor, rehabilitation nurse, dietitian, physical therapist, occupational therapist, recreational therapist, speech pathologist, social worker or case manager, psychologist or psychiatrist, and chaplain. So this was my video about stroke. I hope you have found this video very useful. Thank you very much for watching this video, and this channel Hobeth Bibi is dedicated to help humanity across the world. So please do not forget to share this video with others. Thank you very much. See you in next video. Bye for now.